Hi, have you felt emotionally exhausted after helping someone? It could be a friend, a family member, or a patient for that matter. This is called secondary trauma, and I did not know about it till I read the book Healing Secondary Trauma by Trudy Gilbert-Eliot. And this talks about secondary trauma. Now, what is secondary trauma? This is also known as vicarious trauma. So, any kind of emotional stress that develops from witnessing someone else's traumatic experiences or hearing them, the person who is at this end of the story is the one who is experiencing secondary trauma. Now, who are the people who get affected by this? It could be doctors, nurses, therapists, any kind of first responders like firefighters, journalists who are possibly covering some kind of disasters. It could be social workers, police officers. It could be family members who are looking after someone. It could be a parent who is looking after a sick child. It could also be a friend who is trying to help some other friend who is going through a difficult time in their life. All of these people who are giving care to someone can experience a secondary trauma. Now, what gets affected when someone experiences a secondary trauma? Now, not just your emotions, but your health also gets affected. So, one might experience headaches, poor sleep, muscle tension, just basic fatigue, what is called as the compassion fatigue. Along with that, the person who is feeling the secondary trauma can also start developing anxiety, can feel hopeless, can feel sadness, and can experience a range of other emotions. Then their relationships also tend to get disturbed because they start to withdraw themselves from the society. They start to get isolated, and they kind of become emotionally less available for people because they are done giving that kind of emotional support to the people who need them. Now, these are the things that get affected. Now, this book talks about all the techniques in which you can help yourself if you are a person who is a caregiver and or one of the first respondents who's experiencing secondary trauma. And in case if you don't know if you are witnessing or experiencing secondary trauma, then how do you find that out? So the book talks about a lot of these things. Some of them that caught my eye were the techniques that caught my eye were like finding your triggers, taking opposite to emotion action, then watching your thoughts. They talked about the green red yellow strategy. I think it is here on page 35, the green yellow red strategy. Then they talked about spotting your distorted thoughts and how do you deal with it, and that is somewhere here on page 64. The black and white thinking, disqualifying the positive, amplifying the negative, overgeneralization, mind reading, fortune telling, shooting on yourself and others, and a list of all of those things. Then they've also spoken about mind body healing over here on page 88, and all the techniques that are related to it. um, Writing an essay on how giving care or experiencing trauma or witnessing trauma of someone else has changed you as a person, has changed a loved one around you. Taking care of your own diet, your own sleep, your own health, practicing mindfulness, setting boundaries emotionally, and so on and so forth. There are a list of techniques given in this book. Now, why should anyone care? Many caregivers believe that experiencing fatigue is part of their duty. Um, Ignoring this kind of secondary trauma can actually lead to the person's own burnout. It can disturb their own health, and it can affect the quality of care that they are giving to people that depend on them. So, like they say that you cannot pour from an empty cup, right? So it is important that if you are taking care of someone, you first take care of yourself too. Now, there are several books that are written on the same lines, talking about trauma, secondary trauma, building resilience, dealing with trauma, etc. A few that I have come across are Trauma Stewardship, Help the Helper, Burnout, Body Keeps Score. So these are some of the books that talk on the same lines. Now, check them out for sure, and do share this video with someone who needs to be made aware of secondary trauma, or with someone who you think might benefit from this information. Thank you.